What up, everybody? It's your boy, the Surgical Guru, and today we're going to be talking about our biggest pet peeves in the OR. So I reached out to everybody that I've worked with in the operating room to ask, what are your biggest pet peeves? And I believe that between the nurses, the techs, anesthesia providers, sterile processing, the students, the reps, that if we could find common ground between the challenges in the OR, that eventually we could find solutions to them. So without further ado, let's get it. So when you're working in a high stress environment such as the OR, a lot of times there are annoyances that can get under your skin. I got a lot of responses that were a little bit more serious, but I also got some responses that were hilarious. So make sure you stay tuned to the end of the video to catch them. If you hear your biggest pet peeve in this video, make sure you drop a comment and let us know and tell us your story. What is your biggest pet peeve if you work in the operating room? Lastly, before I get started, I want to send a special thank you to everyone who participated in the questionnaire and took the time to answer my question. You are truly appreciated. So the number one pet peeve in the operating room is bad attitudes, negative energy, condescending, passive aggressiveness, and disrespectful surgeons. And it's no surprise why that is the number one pet peeve. Nobody is in charge of your attitude or your mood. You got to take your happy pills when you wake up in the morning and come to work with good energy. When people have to worry about whether or not somebody is going to pop off or somebody's going to be disrespectful or negative, it makes you hate your job. When you're in rooms where the surgeon is known for being disrespectful or condescending or passive aggressive, it makes you not want to be in that room, and you literally count the hours down until you can leave. It's not fair, you know? And to any student or resident who's coming up in the game, please keep that in mind, because, you know, you want people to be happy to be in your room. You want people to be excited to work with you and to want to put that work in to help you get your cases done as quickly as possible. You know, nobody really wants to work for anybody that's negative. So that is the number one pet peeve, negativity. You know, sometimes you come across surgeons who just complain for no reason. And I think to myself, like, what's going on at home? Is your wife being disrespectful to you? A lot of times I ask people, like, is he or she married? You know, I'm not going to say that is the root of everybody's unhappiness, but a lot of times people bring things that are going on at home with them to work, and it's not right. You know, whenever I'm not in a good mood or something's going on in my personal life, I'd rather just be silent. You know, if I'm dead quiet, then that's how people can tell, like, oh, maybe he's going through something. And sometimes I just don't feel like talking. But I definitely will never take my frustrations out on somebody else in that environment, considering, you know, the people on the table, they have it way worse than us. They're going through so much more than us. They're in the hospital, they're sick. One of my favorite quotes is that a healthy man wishes for a million things and a sick man only wishes for one. So you got to put yourself in those people's shoes and, you know, treat people correctly. All right, so the second biggest pet peeve was lack of accountability, which ultimately leads to a lack of respect for the whole team. One of the most popular phrases in the OR is, "That's not my job." And I can see why that would be people's second biggest pet peeve, because it's a lack of teamwork. You know, when you say things are not your job and you're not willing to help other people, then it's kind of giving off an attitude of superiority and saying that, you know, this is my position and, you know, that's beneath me. I'm not doing that, you know, and we're all in there together. I really value the people who are willing to do things that aren't necessarily in their job description, the people who are willing to just help out and, anesthesia providers who are willing to come over and tie me up, or if the nurse is out of the room, an anesthesia provider grabbing suture and being willing to open it. I mean, that goes a long way and just helping the day move along and keeping everybody happy. Although we may all have different job descriptions, at the end of the day, it's patient care. We are all there for the patients. So you should be willing to do whatever it is that you can. Even if you got to go help SPD and spray some instruments. I mean, like, we're there for however many hours regardless. So the next biggest pet peeve is the room not being stocked or cleaned up. It could be pretty annoying to have to clean up after other people in your room. There are some exceptions. I can understand if somebody was working late, if they were on call and they weren't able to clean up the room, then you get it. But in a lot of circumstances, it's like people just finished up cases and they just leave and they don't want to clean up after themselves. And that could be pretty annoying, especially when you're starting another case and who wants to be cleaning up after someone else, and there's stuff all over the place when you need to get set up for an operation and you want to get things done as quickly as possible. You don't want to cause any delays. You don't want patients to be under anesthesia longer than they need to be. It's for patient safety. And also in terms of the rooms not being stocked, that's another thing. Sometimes people finish up their cases and don't stock up the rooms, which could be pretty annoying when your nurse has to continuously go into the core and look for things, and it should already be in the closet and stocked up. And then the doctor's getting upset and looking at you like, oh, why don't we have this? So, especially routine items that should already be there. So, new surgical techs that are coming up in the game, make sure you stock your rooms after the cases. It won't take you that long. Just take an inventory of what is depleted and what needs to be replenished, and take the time to just go out there, grab it, and restock, and it'll go a long way. And the next person that's going to be in the room would truly appreciate that. Communication in the OR is very important. In terms of our job as surgical techs, we need to communicate with our nurses as far as when it's time to count. Most of the time, the nurse will be on top of it and also communicate with you and let you know, hey, it's time to count. We also need to communicate in terms of when we get specimens to let you know, hey, we got this specimen, it's named this, just in case they didn't catch it and aren't paying attention. Also, we need to communicate anytime we leave sponges inside the abdomen, or if you lose a needle. I mean, it's just important to stay on top of things. And when something happens or something changes, you got to communicate it right away. That way, it doesn't get lost and everybody's on the same page. I know as far as nurses and anesthesia, it's important to communicate when it's time to go get the patient. I know it's annoying for nurses when anesthesia just goes and gets the patient without letting them know, and things like that. And it's also important for nurses to communicate with anesthesia when we're closing and when we're getting closer to being done the case. That way they can start reversing the anesthesia. And there's just so many examples as to why communication is important, even between, techs and nurses and sterile processing. When cases are completed and they need instruments to be turned over for another case, you gotta let them know. You can't just expect them to know. Sometimes they do know, but there's a lot of moving parts and things that are changing in the OR. So it's just best for everyone to communicate. It could be frustrating when communication is not good. So gotta make sure you communicate. The next one I see that is a problem pretty much everywhere is that preference cards need to be updated. Constantly, surgeons are like, how do you not know what I need? I've been doing this case for however many years, blah, blah, blah. And it's like, bruh, the preference cards are not updated. Technology has advanced in so many ways, but not with preference cards. For some reason, it seems like in the system, everywhere that I've been, there's problems with preference cards. I mean, a lot of times they are correct depending on the surgeon, but people who aren't there all the time. Sometimes it's just an issue. I see it everywhere, and it can be frustrating, especially when they're like, oh, I need this, I need that, or a case is picked. You got all this stuff and it's the wrong stuff. Now you got to put all that stuff back and you got to open up a bunch of new things for the doctor, and it causes more delays. And it's just, I personally believe that the preference card system was a lot better when things were just written on paper, and then you could just erase things, rewrite it. It's just better than the computerized system. Another one in relation to the preference card, someone said that the doctor's not knowing what's on their preference card and then get pissed off because you don't have what they need, but it's not even on their card. So you can see how this could be an issue when they could just come in, like 5 minutes before the case and let people know, hey, I need this, 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 and this. So the doctors who do that, you're truly appreciated. Residents, make sure you do that. Make sure you do that. That will make your cases go so much more smoothly, and it'll just, help the flow of your day. So the next one was lazy people. Yes, that could be pretty frustrating. Sometimes there's people who just don't do much and who avoid work at all costs and don't want to do anything, and like we said earlier, we're a team. We're supposed to be in this together. However, these are things that me personally, I try not to focus on. I try not to worry about, because if I focus on it too much, it's truly going to piss me off, because, we're all working so hard to help the patients, and there's always going to be a select few individuals who are trying to do as least as possible. And that's just the way it is. At the end of the day, it really comes down to management to evaluate these people and get them out of here. Not that I'm wishing that for anybody, but at the end of the day, it's like, you want your team to be a team. All right, you had a handful of texts that said they hate when the trash can is taken away. And I can relate. It gets annoying, especially when you have a lot of trash. When I'm setting up for a total knee in the morning and my nurse rolls the trash can to the other side of the room, and I'm like, bro, I got all this trash on my table. Where's my trash can? So whenever that happens, I just take it as a sign that they want me to practice my jump shot. So I just keep shooting, and I'm just practicing my shot. Some days I'm on, some days I'm hitting everything. And then some days I'm off. Some days it ends up all over the floor. But if the trash can was near me, I would have had a better shot. So it is what it is. All right, so the next one that we had is a lack of knowledge. A lack of knowledge of medical terms, a lack of knowledge of instrumentation, and people who are just overall opposed to learning. That could be a little annoying. Me personally, I want to try to learn as much as possible. There's some specialties that, I'll be honest, I'm not really entirely interested in. But, if I'm in that room, I'll ask questions. I'll ask the doctor, oh, what's this, what's that? I'm not completely opposed to learning. But, that's just how it is. I mean, you're not going to get everyone to be interested in everything. It just, I don't know. CSTs and RNs not being treated equally. And the example that they gave was CSTs not getting sleep time. Now, sleep time is when you are working overnight on call and you work past the hours of 12, or you work however many hours, and you come in the next day. And rather than coming in the next day, the hospital giving you the option of staying home and being paid for it. Not staying home the whole day, but having sleep time until maybe 10, 11, 12. It really depends on the hospital. And then being paid for it, which is amazing. Some hospitals have it, some hospitals don't. It really depends on where you work. Everywhere is different. But for nurses to have it and techs to not have it at a hospital is pretty discriminatory. That's kind of crazy. I feel bad for, the people at that hospital who are techs who aren't being paid for it. I mean, they probably still give you the option to come in after, 8, whatever time you want to, but I'm assuming that it's unpaid. I worked there before, but I can't remember. Yeah, that's crazy. That's crazy. It should be the same for nurses and techs. I mean, it only makes sense. It's what is the difference? You're both going in and working, in the OR. So that's messed up. Your circulator wants to count, and you're obviously not ready. And they're standing there with the clipboard, like, you ready to count? And they can see you got things all over your table, but I guess they don't care. I understand to a certain extent because they're being pressured by the doctor, by the front desk, by everybody to hurry up, hurry up, hurry up. And, they're pushing it down the pipeline, and eventually it gets to you and they're like, come on, you ready? And sometimes it can be frustrating considering you have to get things ready so that the case can go as smoothly as possible. You want everything organized so when the doctor asks for something, you can get it to them, and so the case can go smoothly. And yeah, it's just annoying sometimes, It's gotten to a point where, I guess depending on the doctor and depending on the case, sometimes I can just say, like, go ahead, whatever, like, go get the patient and I can catch up, But when it's a new facility and a new doctor, and it makes it difficult, it makes it difficult. And I'm like, dang, like, can you give me a second? Sometimes I say, nah, I need time. But other times I'm like, all right, whatever, do what you got to do. It is what it is. And I just try to catch up. Bad music. Yeah, that could be pretty annoying. People who don't pay attention to detail. Nurses on their phones rather than paying attention to the surgical field. That could be annoying. I'm like, yo, I'm about to close. Can I have some monocryl, or can I have the next suture that I need, please? It is what it is. In situations like that, if I know that I'm working with somebody who doesn't pay attention, then I make sure I have things open beforehand. Make sure I have everything I need. That way I ain't got to ask you for nothing, man. Go ahead, scroll on Instagram, get on TikTok, do what you got to do. Somebody said, hurry up and wait, where you set everything up, you got your room perfectly ready to go. They're pushing you, go, 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 go. And then there's delays, whether it be a surgeon delay or whether it be a delay because they got to get labs done on the patient or whatever the case may be. Me personally, I don't mind hurry up and wait. I love to just slow down, relax. You know what I'm saying? Like, just give me a second to breathe. I do not mind getting a second to just chill. That's cool. Poor leadership. Worst case scenario. I had an experience working where leadership pretty much allowed a toxic environment. There were countless people who complained about this toxic environment and toxic people that were in the environment who were verbally abusive to staff, cursing, disrespecting. And, the manager basically claimed like, oh, well, he's helping you guys. It was crazy. It was crazy. And it made it, this is the only really incredibly negative place that I've ever worked. I mean, there's been management at other places that was not that great, but never a situation like this. This was probably the worst environment that I worked in, and it was, yeah, I was happy to leave, man. That's all I have to say. The next one is a lack of preparedness for cases or emergencies, or surgeons changing the case right before the case starts and having to pick a bunch of things or just having to pick the whole case over in general. Too many people in the room. Me personally, I don't mind it. It's like a party, all hands on deck. Everybody help me out. You grab this, you grab this, you grab that. I don't mind it. It's not something that bothers me, but I can understand how it would bother nurses because things are being open sometimes that don't need to be open. There's too many hands in the pot or hands in the kitchen, and that could be frustrating. Could lead to some confusion, and you want to be able to think clearly. And sometimes when there's too many people in there talking, you're like, yo, everybody get out of my room. The case is picked horribly Now you gotta go out there and repick it. This goes along with a few of them that we've already said, or they're not picked at all. So in some instances, at the last place I was at, when we did robotic cases, sometimes it would be possible open. And it was like robotic GYN cases, and it's possible open, and they got to go underneath. And it was just so many things on the case card that every single time we did cases for that doctor, we'd have to put away a billion things. People coming into your room and touching and rearranging stuff. This ain't your room. Why are you switching things around? What's wrong with you? Get out. People breaking you for lunch and then rearranging everything on your table. What are you doing? This ain't your table. Stop touching my stuff. During arthroscopy cases, when the water gets everywhere, make sure you wear shoe covers, because you don't want to go home with wet socks or have to change your socks. That's disgusting. When it's super late at night, everybody's trying to go home, and then the surgeon lets the residents close. You just sitting there like, damn, I know you learning, but bro, I'm trying to go home. Like, Mayo touchers. It really depends. I don't mind a surgeon that's grabbing what they need, but you gotta give it back to me in my hand. Give it to me in my hand. Please, don't be throwing shit all over my Mayo stand. That is incredibly infuriating, especially when we're moving all quick and then you're making my Mayo stand all messy, and then you're asking me for something, and now I gotta dig under stuff in order to grab it for you. Bro, how you expecting me to be fast when you're the one who's messing up my Mayo stand? So a lot of times, before they even have the chance to throw it on my Mayo stand, I grab it. Grab it out their hands. I know you're done with it, give me that. You know what I mean? So I can put it where it belongs. I appreciate surgeons who hand things back to me. You know what I mean? And if they ask me for something and I'm busy, then cool. I don't mind you grabbing something, but don't be throwing stuff all over my Mayo stand. Not to mention, you might make a hole in it. Come on, man. Do better. For circulators that are sitting there with the clipboard and want you to be ready to count, how you gonna rush me and be ready to count when you ain't even help me open? What? What do you mean? Look, if you don't help me open, right, and you're focused on charting or focused on getting supplies, that's cool. But then don't try to rush me to be ready to count. Come on now, man. I mean, you gotta meet me halfway, 50-50. All right, somebody says circulators that open everything because they don't want to get up and give you anything. Again, wasteful people. When you ask, can I have that suture? And they open up 4 of them. Bro, why would I need four monocryls to close the skin? It's a laparoscopic incision. Do you even know what case we're doing? Shitty schedules and no work-life balance. One of the last places that I worked, the schedule was always horrible. Considering that on the weekends when we worked on call, it was basically like a work day. There were so many cases that were added on that weren't emergencies. So they might as well have had a weekend staff instead of having people be there all day long on call. And you just knew that you were going to be at work. And when you work a weekend and then you also work during the week and then also call days during the week, I mean, like, it's like no time to see your family or see your loved ones or do anything that's fun. So that's definitely a tough one for most medical professionals, especially ones that have to work call. And you just got to put in time for your vacations and put in off days. And nowadays, you know, I make sure that I request my days. That way I don't get stuck working so much and then ultimately feel upset and disappointed because I don't have a life. You gotta be your own representative, or, you know, speak on your own behalf and make sure that you get your days off. And, you know, even if the schedule isn't right, you gotta complain. You gotta say something, because otherwise they're gonna work you to death, you know. And there's some places where they'll have favoritism and some people will always be off and you'll always be on. So you gotta speak up. Next, my coworker said, people who ask me what my biggest pet peeves are. Really, bro? But then he followed it up with, there's a lot of uncertainties in the OR, so you can't be too upset when there's a lot of running. It's a very optimistic perspective, and I appreciate your positivity. Medical students who show up without talking to the doctor.
Wait a minute! Who are you?
Residents who take their place at the field and expect nurses to reach around them to plug in the bovie and secure the cords.
What are you doing? What are you doing?
Nothing. Me? Just hanging around.
She also said doctors who time out while she's gloving. Come on, man, give her time to get her gloves on.
Hold up. Wait a minute.
We have a nurse that says people who do not check the case cart and grab supplies, grab gloves and sutures. I feel you. New people in a facility bragging about what they've done, what they know, where they've been. Yeah, that's a sure way to make sure people don't help you. And then eventually you turn around and need help with the things that you said you know and all of this. So like, don't be a no beginning. Even if I know something, don't say that you know. You know what I mean? Like, just be like, thank you. You know what I'm saying? And me personally, I'm like, you know what? I'll take the lesson again, whatever. Just explain it to me, you know? And a lot of times, as far as being a traveler, people do things differently everywhere anyway. So I'm not going to cut someone off and be like, I know. You know, I'm not trying to impress anybody with everything that I know and saying that I know. You know, all you got to do is just work, and people will see what you know by your work. So, bad food. Yeah, bad food is definitely a pet peeve of mine. But honestly, I haven't been to that many hospitals that have good food. I mean, only a few, especially since I've started eating a lot healthier and eating home-cooked meals. You know, I'd rather pack my food. I make sure that I have food. Or I fast. You know, I try not to eat the food at the hospital. Sometimes it's tough. Sometimes I'm hungry and I eat it and then I complain about it. And I'm like, damn, where's the season? This nasty. You know, but it is what it is, man. It's crazy to me that at hospitals, they don't have healthy food or tasty food, considering it's a place of healing, quote unquote. Surgeons who refuse to use the smoke evacuator bovie. Smoke is dangerous. Use the bovie. What's the problem? It doesn't fit in your hand well. You can't get the job done still. Come on, man. You want us all to smell that smoke? Like, that's literally carcinogens that's gonna give everybody cancer because of your uncomfortability? That ain't right. Said lateness. Make sure you're not partying too late. Make sure your alarm is on. You gotta get to work on time. Someone said new nurses that are trained by surgical techs in order to take our positions. Yeah, I mean, it is what it is. I understand that most hospitals are trying to get away from travelers and start using more nurses or start hiring full-time surgical techs. And I understand it. They're trying to save money. It is what it is. It's business, you know? So I don't take it personal. But at the same time, you know, I guess it's just funny. I mean, like, I just joke about it. Like, I'm happy to train the next person that is going to be doing the job that I'm doing, because I want them to do it at a high level and I want them to be able to help the patients. And that's what it really comes down to, regardless what their role is. My boy said CSTs don't get the respect they deserve. And I mean, at the end of the day, you got to respect yourself, because not everybody is going to be, you know, I don't know. It is what it is. I guess I just don't care. Me personally, I'm like, you know, I'm here for a reason. I'm here to take care of the patients. I'm here to do my best and to be satisfied and fulfilled with the work that I'm doing, you know? And whether or not the surgeon across from me appreciates it, whether or not the nurse appreciates it, whether or not they respect what I'm doing or not, it doesn't matter, because I respect what I'm doing. So I don't care, you know? But I understand how that can be a pet peeve for some people, especially when, you know, people blatantly disrespect what you're doing. That ain't right. You know what I mean? But at the end of the day, whatever, you know, if I can make friends or make acquaintances or meet good people in the environment at a certain hospital, then I'm happy. But, that's not necessarily what I'm there for, So I'm there to do what my job is, and I'm more than happy to do that. Being relieved late for no reason. Sometimes people delay the process of getting you out when it's time for you to get out. It's time for you to get out at 5 o'clock. Maybe you clock out at 5:23 and they come into the room at 5:20 or 5:15. That could be a little annoying. I ain't gonna lie, because when it gets close to the end of my shift, I'm really thinking about, dinner or working out or going to boxing or whatever it is that I want to do, seeing my kids. So it could be pretty frustrating when they're stumbling into the room all late, especially if it's for no reason. I think that just comes down to common courtesy. You should treat people the way that you want to be treated. So if you want people to get you out at 5:20 when you clock out at 5:23, then don't be surprised when the same thing happens to you. You know what I'm saying? And don't be upset about it. It just is what it is. Me personally, I feel like, all right, I shouldn't treat people the way that they treat me. I should do things that are reflective of my character, but you never know how I might feel on a particular day. I might just be feeling petty. You know what I mean? I might just get you out at 5:23 too. You ever worked with a doctor that's like,
What did he say?
like, bro, I can't hear you. We're in these ortho hoods. It's loud in here. The bovie's going, the smoke's going, the anesthesia machines are going. Like, dang, bro, sheesh. I mean, people who mumble and then they get mad at you when you ask them, what did you say? You ever scrub into a case and then you're like, oh, my nose itch. I mean, in that situation, it's cool to have a nurse that wouldn't mind walking over and pulling your mask down and scratching your nose for you. And then also, have you ever had a runny nose when you're in the OR? That is the worst experience in the world. I hate it when my nose is running, because it's not like, it's not like you can change your mask in the middle of a case. So it's like, yo, that mask is so uncomfortable. It's one of the worst experiences in the OR. OR lights hitting your head. That does not feel too good. Said rules being put into place and then not being followed, like timeouts. There's a bunch of surgeons who don't care about the timeout. We just go right past it. There's some nurses that I know that don't put up with it. They'll be like, nah, what are you doing? And then there's nurses who are just like, whatever. It's a patient safety thing. We should be waiting so that, there's no risk of a fire. All people related. Overnight room not being set up. Surgeons who don't prioritize the count. Yeah, man. Don't you want to make sure that nothing is being left behind in your patient? Sometimes, I don't know, there is a sense of arrogance where they're like, oh, I don't leave nothing behind in the patient. Nurses who prioritize charting to patient care. And I understand to a certain extent, because there's so much pressure on you to do your charts and you want to get it done. You want to get it done. You don't want the repercussion or backlash from not doing it. So I understand why you're focused on it, but we cannot forget that patient care comes first. They said ancillary staff like CRNA, CST, or students or residents repeating what a doctor said after they said it when he heard them, obviously, and is already in the process of doing it. He's like, bro, I heard them. Why are you repeating it? Nurses who ask for the room temperature to be turned up when they're not scrubbed in. They don't have a gown on. They don't have gloves on. I feel you. I understand. It can get pretty toasty in there sometimes. I actually passed out once in my life. My blood sugar was low. And yeah, it was a weird experience. I was in a case and we had x-ray gowns on and I overheated. And yeah, I passed out. It was crazy. Residents I never met thinking that I have their gloves. Yeah, that's why I'm always like, yo, what's up, man? What's your name? Blase blah. My name's Derek. What's your glove size? I got a gown already. You good? Let me get your glove. The thing is that people are new. So, a lot of times they're nervous. They got different things running through their mind and they may not even remember that they need gloves until the second they scrub in, and then they're like, oh, I need gloves. So have some understanding. Short staff increases the workload and stress. Absolutely, it definitely does. That's why it's hard for me to understand sometimes why the hospitals are so focused on saving money instead of making sure that we have the adequate staff. You know, it sucks when you come in the morning and they tell you, you know, such and such and such called out. And you know, like, yeah, today's going to be one of them days. Like, I'm going to be working hard in my room from 7 until whatever time your cases are done, whether that be 2 or 3. And then you're going to be going right back into another room if you're a 5 o'clock person. And unless you know you're getting out at 3, then you're like, I'm cool, whatever. I'm going to be getting out of here anyway. And yeah, sometimes it could be a very tiring job, you know, when you're bouncing room to room to room, you're on your feet basically all day. Yeah, and you get a few breaks, a 15-minute break in the morning, 20 minutes if you're lucky, and then a 30-minute break for lunch. So out of those 8 hours, you're only off your feet, or 10 hours, or 12 if you work 12s, you're only off your feet for 50 minutes? So yeah, the job is I commend everybody who works in the operating room because it's not easy. It's not for the weak. CSTs and earbuds. Yeah, I'm guilty of it. You know, in the mornings, I like to wear my earbuds to set up because sometimes I just need that extra motivation. Sometimes in the morning, you know, if I didn't get a whole lot of rest the night before, I can be pretty tired. And if I'm listening to some music in my earbuds, then it can give me that extra boost that I need to like get the setup done quickly. You want me to be fast, right? Let me get my music, all right? But I understand. They're like, oh, it could fall out. Even though my earbuds don't fall out. The only time my earbuds fall out is when I'm working out. You know, my earbuds fit my ear perfectly, so... But I get it. I get why that could be a problem. You wouldn't want that to hit the field and contaminate the field and have to start over. And, you know, I don't wear them during the case, though. I just wear it to set up. So I don't think that should be a problem. That's just me. Here said people who wear gowns instead of jackets when the gowns are supposed to be for procedures when you're scrubbed in. I understand that. You shouldn't waste the gowns. That's a waste when we have jackets that you can wear. That really doesn't make that much sense. Bad pay. Yeah, I feel like medical professionals are underpaid grossly.
You're poor.
You know, it's crazy to me how being a YouTuber, you can make a lot more money than being a medical professional. What sense does that make? But that's the world that we live in. You'll make a lot of money if you're an entertainer as opposed to somebody that's helping people. Doing OB. Yeah, some places OB has staff that will do C-sections in other cases. And at some places, they don't know how to do it, so they have the OR team go up to the department and do those cases. And I can understand how that could be frustrating for some people. I don't mind. I like seeing the babies born. I'm like, hey, cool. Answering pages and calls for surgeons and residents. Yeah, that's why I'm happy I'm a surgical tech, because that would be annoying. You know, constantly answering the calls, and yeah, that wouldn't be my thing. A cute woman with a wedding ring on. Come on, bro. Then he also said, the word boyfriend being used in the OR. Really, bro? Come on, man. There's a lot of fish in the sea. There's women who are single. Go for them. Tangled cords, alarms, hospitals giving the staff proper training because that can be unsafe for patients, people who are performing these cases and operations, whether it be surgeons or residents or surgical techs or nurses, and who aren't properly trained. It's definitely a patient safety issue. Sales rep showing up 15 minutes before the case starts. Like, come on, bro. We need you to check the equipment. We need you to make sure we have everything we need. Like, dang. You know, stuff happens sometimes, but like, come on, man. Come on, man. There's actually somebody I used to work with, a sales rep, that would do that consistently to the point where that actually ended up being one of his nicknames, which is kind of sad. But it is what it is. As you get more experience in your career, things like that end up not being something that frustrates you as much because you're like, all right, I know what we need anyway, and I know how to check for things. But early on in your career, that can be definitely a roadblock or something that is a pet peeve because I need your help. Like, where you at? When a student is too close to your field and you say, yo, back up, you're too close, and they don't move. I asked an anesthesia provider and they said when it is too loud before sedation, they're like, shh, be quiet. Patient's going to sleep. Anesthesia said people not changing their gloves after touching a patient's mouth, saliva, after putting in an IV, it's pretty disgusting. Or putting dirty mask on the machines, that's pretty disgusting. Or not capping syringes after using them, like, that's dangerous. Like, man, come on, man. An anesthesia provider also said messy charting, and that's something that I'm sure nurses can relate to. That could probably be annoying. That's the one thing that I love, or one of the things I love about being a surgical tech, is that I don't have to worry about charting ever. That's great. Surgeons who think that we are Dr. Octopus and we got 4 arms. Like, bro, I'm trying to hand you one thing. How do you expect me to grab this too? Like, what? Management sending people home and then the late staff not having help. That could be pretty frustrating, especially when favoritism is involved and the same people are going home every day. It's like, can't be a hypocrite because I used to go home a lot. I'm not doing it anymore because I'm trying to get this money right this year. Mindfulness of sterility and sterile technique. Yes, 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 yes. It is definitely a pet peeve when you work around people who are not mindful of their sterility and sterile technique, and it is quite cringeworthy. I mean, it makes you squirm when you're watching somebody. Me personally, when I'm watching somebody and their technique is not up to par, their hands are going low, their hands are going high, you're just like, oh, bro, like, come on, man. You know what I mean? Like, some seasoned techs, I don't know, some people are just, you know, even if you try to tell them, like, hey, your hand was kind of low, you did this, you did that, they're like, oh, no, they don't want to hear it. Toxic gossip in the OR. I try not to get involved with that at all. You know, I try not to listen, I try not to be around it, and I try to walk away whenever it's beginning because I don't want to know. I don't want to know, I don't want to think about it. Gossip is mental poison, you know. Said opening supplies on the back table and not opening them in the basin. Yeah, this is very annoying, especially when it's a big case. A lot of times this happens to me when I'm setting up for a total knee or a total hip, and it's a doctor that uses a lot of things and things are all over the table, and I'm like, damn, y'all could have put that in the basin or at least waited until, you know, I scrubbed in, because now you got to dig underneath of everything. It's especially worse when they put things on top of your gloves. You know, you're just like, bruh, like, come on. And to close it out, I want to read what one of my coworkers that worked in sterile processing had to say about her pet peeves. So the first thing that really bothers me is that there is a disconnect between sterile processing and the operating room. I've had various roles in the surgical field, but my greatest passion is sterile processing, but more specifically, the functionality of the instruments. The disconnect I speak of is that though we may understand each other's role, but do we really know what each other does besides what our job descriptions describe, what we do for the surgical world? There is most certainly a lack of appreciation of knowledge on both sides. One side always knows more than the other, when it's the opposite. Surgical teams know what the instruments are for and how they should be used. The SPD team makes sure that you have the instruments and the functions they are to perform. When we see something in SPD, we are often dismissed or our concerns downplayed. To fix this, it's more than shadowing, more than just observing. We need to immerse ourselves in each other's crafts. I don't have an easy answer to the question or a solid solution, but we have to start somewhere. And like early education, we need to start at the basics. We need to truly see how the operating room runs their cases with special attention to the instruments. For the operating room, it would be seeing each side through. Decon, clean, prep and pack, and storage. Not just a day either in each area, but a few days for each side. I couldn't have said it better. That was perfect. She said her second pet peeve is opening trays for one instrument. I understand that sometimes trays are open because they may have a need for a variety of specialized instruments prudent for the case, but it becomes an issue when we open a whole tray for a sole item. If something is consistently being used, we need to increase the par level of that instrument. It would not only save time in reprocessing or counting in the OR, but it would also save money and resources on both sides, as well as prolonging the life of the instruments. Reprocessing takes time and puts strain on the instrument that are often used. And just one more thing, the final thing that truly bothers me is when pre-cleaning is not done. Long cases, especially ones that result in a lot of blood and bioburden. Spraying the instruments and leaving them in an unlocked position creates less damage to instruments as well as beginning the cleaning process. This way, in decontamination, they are able to break down the trays easier and with less bioburden. It makes the reprocessing times quicker, which gives more accurate turnover times. I could continue, but I feel these are 3 issues would be my biggest pet peeves and would like to see a solution to either or both. So there you have it. There are the biggest pet peeves in the operating room. I believe that this video can serve as a guide for everyone that works in the OR to help us find a midline in these issues and eventually try to find solutions to them, and to just be aware of everybody that's in the OR and how we can, help each other out and be a better team and ultimately give the best patient care to the patients. So it's your boy, the surgical guru. If you have any pet peeves that you heard underneath that you can relate to, make sure you drop a comment. Let us know about your story. Make sure you subscribe, like, and stay tuned for more videos.